why would our Congressman Dan Lungren would want to vote to repeal the health care law. Because it seems to me he doesn't care about me and my family or you and your family. He cares about the insurance companies and them making profits on us and our well-being. The current health care law has benefited me and my family. And first, you know, I've served my country in the military. I was in the U.S. Marine Corps. I was an intelligence officer and sniper. And then after my tour of duty, I worked several years with jobs that had no health care or very limited health care coverage.
My name is Teresa Villasenor, and I live in the 3rd Congressional District. I'm a single mother of 5 children, 3 of which are over the age of 18. 2 of my children are here with me. They're 21 and 20 years old. So when they turned 19, they didn't have any health care under me anymore, and it really hurt our family because they got sick, they incurred hospital bills, and in turn those bills, you know, come down to the parent. They can't afford to pay those bills, so I have to help them. When this bill passed, that they were able to get on my health care until they were age 26, it was a blessing for us because now they can see a doctor and take care of their needs, and the burden is a little bit less on me.
My parents were making bad choices, and that's hard for daughters to look at. When it came to food, housing, and prescription medicines, getting necessary medical treatment, basic tests, because they couldn't afford them. We brought them into our home so they would make better choices, or we could help them make those better choices. No longer having to worry about food or housing, they now get the medical care they require. Each year they fall into the donut hole, making their prescriptions very expensive. This fall, my dad got one of the first benefit checks of $250 just as they were purchasing his very expensive medicine. My mom got her check right around Christmas. At the same time, she had to pay over $100 for medicine necessary for her health. The repeal of the Health Care Reform Act in the 3rd Congressional District would cause my parents to continue to fall in the donut hole for their prescriptions. This law provides that starting this year, they actually would get a 50% discount on those prescription drugs. We should take care of our seniors.
I was uninsured for 4 years, finally got Medicare, went to a doctor, and I was really, really lucky because in that 4 years I did not see a doctor. And when I got Medicare, I went and got all of the tests, and there was nothing wrong with me, which is just a miracle. And but it cost me upwards of $600, and I'm still paying that off. And so I was so happy that now we were going to finally get all those preventive tests covered. Those things are expensive, very expensive, as you probably know. And that was a benefit that was going to help every single citizen just about in the country. And I find it just awful that that's going to go away.
Everybody for coming out today on this low point of our democracy, where the U.S. House of Representatives is making a decision that, despite an election about the economy, despite all the talk about jobs, the first thing they decide to do is to go backwards on providing people some basic health care. They're not the only ones. In this district alone, 3,400 young adults are going to get coverage through their parents' coverage as a result of this law. And Representative Lungren wants to take that.
Now we're going to have people who are going to go inside and talk to their congressman and ask him why he wants to repeal this health care law. Thank you very much for coming.
Because you're saying to fix the bill and that he's got pieces he wants to work on specifically. But he's voting to repeal the whole thing today.
Absolutely.
The whole thing provides his daughter with health care today. It covers
My parents
her
in the
parents
donut hole.
who fall in the donut hole. We have another lady here who's got, Teresa, who's got 2, these are your constituents.
Absolutely.
She's got 2 kids here with her today who have health care as of January 1st because of this new law.
Right.
So that's not a piece that should be repealed or improved upon.
Well, what we feel is that the bill that was passed, the entire package that they passed last year and that President Obama signed into law, was not a bill that as a whole and as an entire concept was something that we could support. And so we are supportive of repealing the entire bill and then continuing to work for ways in which we can increase access, reduce costs of insurance to all, so that more people have it. Part of the problem is we have constituents, we have a lot of constituents who are in the Medicare Advantage program, and that is being stripped out of this process. So we have a lot of seniors who are actually on fixed incomes.
I'm a member of Medicare Advantage. That's simply not true. My plan has not been affected. And respectfully, we're tired of seeing Mr. Lungren and others like him play politics with our health care. Right. And we want to see you work to make this law pass, to be effective and to implement it, not to play politics with my health care or with my friends' health care.